Thank you. I appreciate the opportunity to come and speak to you today about the free market movement in America and how successful we think that it has been over the last few years, how it continues to grow. Hopefully I'll be more optimistic than pessimistic and tell you about the good things that are happening. But I think it is important to tell you a little bit more about why the medical system that we have is about as far from a free market as it could possibly be. As building on some of the things that the previous speakers have said, thanks to Dr. Sim and Concordia for hosting this conference. There may be no other topic outside of education that is more important to the future of our nation than healthcare. These are the two areas, by the way, that the government officials have spent the most time keeping their hands in for the last 100 years. So is it any coincidence that both are in serious need of disruption and innovation? Sorry, I probably hit it. It was my bad. The Free Market Medical Association is not an association of doctors, although we have many physicians as members. It is not a lobbying group, although we educate politicians, business owners, and the public about the importance of free markets in healthcare. Our mission is to unite all the islands of excellence in free market, transparent, consumer-driven healthcare, which is almost the exact opposite of our current system. I'm the executive director of the FMMA. I've been a student of free market economics and its application for 2 decades. Before taking this role with the FMMA, I worked for the Mises Institute, which is the academic center for Austrian economics around the world. And I'm also involved with the Libertas Institute, which works on free market policy nationwide and produces educational resources for children. When talking about the FMMA, it is necessary to begin by speaking briefly about the economics of healthcare, as the FMMA was founded based on free market principles in theory and in practice. Many of you are probably aware of Dr. Keith Smith, co-founder, medical director of the Surgery Center of Oklahoma. Dr. Smith is also the co-founder of the FMMA. Before opening the Surgery Center, Dr. Smith became a student of the Austrian School of Economics, led by Karl Menger and Ludwig von Mises and others. The Austrian school emerged as a counter movement to the growth of Marxism in the early 20th century and Keynesian economics, which became the basis for most government intervention that we saw in the 20th century. The Austrians taught that it is the subjective value of consumers that causes prices to emerge in a free market. In an unhampered free market, consumers are sovereign, have free choices, and entrepreneurs drive innovation and production. The price consumers are willing to pay determines the structure of production of those goods and services. In this context, the role of the entrepreneur is essential to imagine the future of what consumers will value most. Good entrepreneurial judgment results in profit, and bad judgment results in losses. The results of a free market are consumer sovereignty and entrepreneurial innovation. In areas of the economy with the least government intervention, these results are maximized, and over time, prices fall or tend to fall while quality of products and services improve. This is not the case in most of our healthcare system. Consumers rarely even know prices before a service is purchased. The consumer is rarely paying the initial bill, and there are very few new competitors or entrepreneurs entering the marketplace. So what does our current healthcare system look like? We heard this a little bit already, but does it look like a free market to you? Here are some of the results government intervention in healthcare have brought about over the last 80 years. Number one for me is cronyism. Cronyism is the facade of a free market where government bureaucrats make decisions that impact profit and loss and restrict new competitors from entering markets. Essentially, profits are privatized and losses are socialized. Distortion of supply and demand. Government payment of medical services artificially increased demand, which led to various schemes for rationing care like HMOs and now accountable care organizations. Supply is also limited through medical licensing laws, certificate of need laws, and limits on medical residencies that we've heard about. Quasi-monopolies are encouraged and subsidized by the government. The AMA controls medical schools and acts as a central planning agency in many ways. The Affordable Care Act and other regulations have resulted in a small number of major insurance carriers and 3 major pharmacy benefit managers controlling most of the market. Corporate consolidation is always driven by government intervention. Regulations always favor incumbents and major industry players. An example would be electronic medical records being forced on physicians. These payment rules have led to the consolidation of independent physicians. More doctors are now employees of hospitals than independent entrepreneurs. The medical lobby has grown to the largest in the country. Almost every politician in Washington, D.C. is funded by big hospitals, big insurance and pharmaceutical companies. Corporate consolidation leads to insider deals and have raised prices even more. Large hospitals maintain the fiction of a not-for-profit status using what Uncle Sam calls uncompensated care. This encourages the made-up charge master price that Dr. Sim talked about of healthcare to rise to astronomical proportions. At the same time, big insurance carriers are usually compensated as a percentage of savings based on the same financial game. The Unaffordable Care Act, as we like to call it, also set medical loss ratios that fix profits to a percentage of the cost of medical care. Anyone with an ounce of common sense would have realized or had the foresight to see that this would only raise the prices. It is no wonder that we have heard stories of insurance executives actually encouraging their hospital partners to raise prices. So true entrepreneurial innovation has largely been replaced by opportunists. Most of today's venture capital startups in healthcare are merely new ways to profit from gaming the existing system based on cronyism and lack of transparency and keeping buyers and sellers far removed from each other as possible. The bottom line is, sounds like a negative story, I know. We'll get to the good part. We have broken doctor-patient relationships. Patients are rarely seen as customers, but as vehicles for a convoluted payment system that is facilitated and subsidized by government. Insurance carriers see the hospital partners that they have negotiated these lucrative deals with as their primary customer, not the patients. The current American health system is more of a wealth transfer scheme that uses healthcare as the vehicle. Prices have been artificially increased through government interference, regulations, subsidies, and special interest favors. The obsession with coverage instead of cost and free market prices has made the majority of Americans functionally uninsured in light of rising deductibles that are rarely met. If you're in a private employer-paid plan, that plan is also very likely exposed to outrageous costs driven up by crony network deals and insurance brokers who receive massive bonuses. Each year, your premiums continue to rise. Deductibles and premiums rise year after year while benefits decrease and potential salary increases are stolen from employer profits. So what can be done about all this? Will more government solutions to fix healthcare reverse any of this to the extent that Washington has already been bought and sold primarily by the medical lobby? The executive order for transparency was a significant step toward changing the narrative and increasing demand from employers and patients for more transparency. But it's my fear that more legislation, at least at the federal level, will have the unintended consequence of allowing hospitals and big insurance to redefine what transparency means. True price transparency is not simply your out-of-pocket charges. Fortunately, There is a movement that is already following free market principles of price transparency and direct exchange for medical services, and this movement is being fueled by the Free Market Medical Association. The idea for the Free Market Medical Association emerged from the buyer-seller relationship of Dr. Keith Smith and Jay Kempton. Keith Smith co-founded the Surgery Center of Oklahoma, and he realized that Jay Kempton, who represented a cash buyer as a third-party administrator for self-funded health plans. At the same time, Jay Kempton realized that cash providers could save his clients, the employer, lots of money, millions of dollars in their health plan. So as this relationship between a buyer and seller grew without middlemen and insurance contracts, a grassroots movement was already taking off around the country. More physician-owned surgery centers started adopting the Surgery Center of Oklahoma's cash price model. The direct primary care movement was taking off, and a growing number of benefit advisors started breaking from the traditional insurance broker model and started working directly for employers on cost containment strategies. All this opened the door for alternative solutions and a new marketplace that improved quality while lowering cost. The FMMA began as a mission to bring all these positive movements together and bring others with a roadmap, provide others with a roadmap to implement the strategies that had worked at the Surgery Center of Oklahoma and the Kempton Group. To provide an antidote to these problems in healthcare we discussed earlier, the FMMA was founded on three basic pillars: price, value, and equality. All members must hold to these principles to be a member. So number one, price is not a product. Care is the product. Selling access to pricing is anti-free market. Discount brokers who get paid by selling savings are not transparent. Health plans have been forced to rely on PPOs and networks to give them access to a % off billed charges. This system has done nothing to curb the rising cost of care and has instead contributed to the increase. By selling access to the discount or price, it is highly beneficial to the establishment if the charges are excessive. Percentage of savings and other discount schemes only serve to raise the cost of care. Value. Value is determined by a willing buyer and a willing seller agreeing on a mutually beneficial exchange. Price and quality are determining factors for consumers to find value. The medical industry has tried to mimic this recently, this market reality, by beginning to try to focus on value-based care. Sounds really good, but the problem with this is that we still have central planners attempting to aggregate individuals and their preferences to fit into a one-size-fits-all standard of value that can be used as a metric for payment by either government or an insurance contract. Finally, equality. Equality for the FMMA means that cash is king, and a cash price should be the standard of value for all consumers, regardless of how they're paying, what their contract is. Physicians and other sellers of medical care should be bold enough to declare their value in the marketplace, to declare what their services are worth, and let the market judge if their price is fair or not. Since 2014, the FMMA has grown to more than 300 members all over the country, representing all the economic actors in this new free market ecosystem. Our members can be divided into three groups: sellers, buyers, and vendors or facilitators. We don't have a problem with middlemen. We often talk about middlemen in healthcare being a problem, but a middleman in a free market is going to add value and not just drive up the cost. So as long as a middleman or person is providing some kind of service for the buyer and the seller, in healthcare, we basically, on the broker side, we have like a real estate broker working for the buyer and the seller at the same time. You know, there's a conflict of interest there. So everything is sort of turned on its head in healthcare, unfortunately. Sellers would be DPC practices, surgery centers, specialty care, diagnostic imaging centers. We have some cash ER hospitals that are members as well. Buyers, of course, everyone in this room is a buyer of healthcare goods and services. Primarily, our buyer members of the FMMA are self-funded employers, independent TPAs, third-party administrators. Innovative benefit advisors like Health Rosetta and Mitigate Partners are two of those. Medical cost sharing organizations that you've probably heard about, Sedera Health, Christian Health Share Ministries, Liberty Health Share, those are growing all the time. And facilitators are these middlemen or entrepreneurs that actually add value to the buyer-seller relationship. Companies that manage and sell cash bundles like Atlas Billing, real insurance for major medical. So entrepreneurial companies that are facilitating the shopping for care among providers like Sesame Health and Vitify guy that's here today would fall under that category. Transparent pharmacy benefits. We talk a lot about pharmacy benefit managers being part of the problem, but there are some PBMs that are actually passing savings on to employers, and there are companies that are monitoring and checking PBM payments to make sure that they're honest. Free market economic policy organizations like the Texas Public Policy Foundation, David Bellot, who's here today to speak. Like-minded trade and advocacy organizations like the Benjamin Rush Institute, Docs for Patients Foundation, Patients' Rights Advocate, and others are all great partners with the FMMA. Most of this very diverse group of healthcare professionals have broken away or are currently in the process of breaking free from the established medical insurance matrix. They came to the realization that for too long, they may have been part of the problem rather than part of the solution in lowering the cost of care. The FMMA is helping them make the transition and giving red pills to others. That's the title or the theme for our conference coming up next month is, are you ready for the red pill? It is not necessary for even possible to coordinate the actions of these people in a market-based system. That's not the point. The FMMA doesn't seek to create a new cash network, but the organization serves as a facilitator for cash buyers and sellers to more easily connect with one another. To encourage a decentralized movement, the FMMA now has 25 chapters, local chapters around the country where like-minded people can share ideas and bring employers and providers together in local communities. So what have been some of the results and outcomes of this growing free market medical movement? This is the exciting part. The emergence of true market prices, for one. Keith Smith started posting his prices online as an act of defiance as the major hospitals in the area tried to put him out of business. But today there are multiple avenues to find cash prices for many services and procedures. The FMMA has even created a tool called Shop Health, where our members can post their prices online. Consumers can trust that these are truly transparent prices. Companies like Sesame Health are aggregating prices from cash providers and putting them in user-friendly apps. Other companies like Coral and MetaBooker are creating tools for employers and their employees to easily access transparent cash providers. We're seeing a return to consumer sovereignty, or that consumerism that Dr. Sim talked about in healthcare. As more and more families are falling into high deductible health plans, more people are finding it necessary to shop for healthcare services. In many cases, someone with a high deductible plan may be better off not using their insurance at all, because the out-of-pocket costs for their insurance discount may be more than the cash rate. We're seeing the restoration of the doctor-patient relationship that we heard about being broken. Independent physicians are not employed by a large hospital system. They have more time to spend with their patients, and they can be your financial advocate as well to send you to the most cost-effective place to get diagnostic testing or lab work done, because they're not incentivized to send you to the hospital that they're owned by. Happier employees with better benefits and higher pay. Who can argue with that? Using the principles of an employer built rather than an insurance built health plan. Many employers are now offering better benefits to their employees while saving millions of dollars, eliminating all the unnecessary middlemen involved in the traditional PPO plans. These employers are then able to pass these savings on to their employees in better wages. One of the first rules of economics is there's no such thing as a free lunch, right? So we all know that if your employer is trying to give, well, this lunch, it was paid for by someone, and we thank them for doing that. Health benefits are not a gift from your employer. Every dollar your employer spends on healthcare is ultimately being reallocated from your paycheck. Independent and happy physicians are restored from this burnout that we heard about. Physicians joining the free market medical movement no longer feel like they're doing financial harm to their patients. DPC physicians are relieved from much of the administrative headache of billing codes for insurance carriers, and they can spend more time doing what they became a doctor to do in the first place. And finally, this is so important, less medical debt and bankruptcy. Medical debt is the leading cause of personal bankruptcy. And guess what? At least 70% of individuals bankrupted by medical bills had coverage, and they still are facing bankruptcy. I won't talk about, I do feel there are some optimistic things that can happen on a policy level, but I'll let David talk about that later, especially on the state level. But yes, I do feel like there are some things, deregulation that can happen that will benefit this movement. But we have a lot of reason to be optimistic about the future as more tools are developed to highlight price transparency. More hospitals are starting to make good faith efforts to respond to the growing consumer demand for transparency. Some you might be surprised to know are even starting to join our movement by contracting with some of these aggregators of cash bundles for maternity care and other services that have historically thought to be unshoppable. More patients are becoming empowered to ask for a price before medical services are performed. There's a great book that's out now by Marshall Allen called Never Pay the First Bill. I suggest you read that as well. A tipping point, or more patients are becoming empowered, and a tipping point will soon be reached that no political force can stop for this movement. It's a testament to the power of the free market that, in spite of all the momentum behind years of government intervention and cronyism, we're now seeing a lot of movement in the direction of transparency and lower prices in healthcare. And the FMMA is adding fuel to propel this movement forward. Thank you.